Then I'm going to call on the next questioner, which is Rose Shapiro. Rose. Yeah, great, go ahead.
Does the panel think, in the current economic climate, that there's any chance of all dying cancer patients having access to 24/7 care at home, if that is what they choose, say within the next 5 years?
Well, that goes to the heart of Macmillan, doesn't it? That's what Macmillan's all about. Who would like to take this up?
I don't mind taking this up. I think that there's quite a good chance that that might happen. Evidence, there is shedloads of evidence to say that where people are well cared for at home, by people like Macmillan, then that, and if that's where they want to die, then that's absolutely the right thing to do. And it's best for patient care, it's best for families, as long as that's what they all want. And I think there is another side which is tangential, but in these days you can't ignore it. It's actually a cheaper option than having somebody in an acute hospital going up a bed. So for the government it should be a win-win thing. It should be really, really good for patient care, and also it doesn't cost as much. And I think that sort of thing is beginning to come through. There is something called the Liverpool Care Pathway, which is being really, really seriously debated at the moment. And I think that my personal view is that there is absolutely nothing wrong with the Liverpool Care Pathway. What has happened is that there have been some quite high-profile poor practice around the Liverpool Care Pathway that has put it into disrepute. So
this is a pathway that's been pioneered in Liverpool, is it?
Well, it's actually rolled out pretty much across the country on sort of how to manage somebody's death. It's acknowledging that somebody's going to die, and you need to work with carers, you need to work with patients and clinicians to get it just right. And that hasn't always happened, which is to be regretted. But I think there's been a report as well this week from Nuffield, which is a sort of a health think tank, which actually is around Marie Curie. But it's hugely supportive of the whole idea of nursing people at home. And I phoned Nuffield yesterday and said, is there any reason why this shouldn't just factor across to the service that Macmillan Cancer Support offers? And they said there's absolutely no reason at all. We just happen to do it with Marie Curie. So I think there's every chance it might happen.
But as Judith has implied, I mean, it's actually cheaper than having somebody in bed in a hospital.
I think that's right. We know that 3/4 of people would prefer to die at home if they have the right support, and that but only 1/4 of people do die at home. And so quite clearly one of the contributions is not being secure because there isn't nursing support if things go wrong. And it may not always be a visit, it may be access to a phone call, it may be access to all sorts of things, but this generalist nursing, at home. And some areas get it right. We know that it's quite possible to get it right. There are regions who do get it right, but there are regions who don't, and an awful lot of them don't. And so I think it is something, it just really, in many ways, it's a no-brainer, making sure that there is proper nursing support to make sure that people...
How could Macmillan be expanded to meet the need? What role would the state have to play?
I think there's two things to think about. I mean, there is a number of steps of nursing care which will avoid you dying in the wrong place. One of them is the preparation, is making sure that people talk about what they want at an earlier enough stage, and we know that they don't. So we're working a lot with primary care and GPs to introduce the conversation about dying at a very early stage. And indeed today is the 20-year anniversary of our GP community, and they're all meeting together to discuss really how to do that. It's not just about the nursing, it's preparing for the process. It's
a difficult balance there, isn't it? Because clearly there are people, you can't be quite sure where you are in the cycle.
Exactly.
And to start discussing whether you want to die at home or in the hospital, you may not have decided you want to die at all.
Most people, but I think it's a bit like taking out insurance. You take out insurance because you want, if you lose your luggage or if something happens, you want to make sure that you've covered the worst of it.
So you reduce it perhaps back to, well, what sex are you? And by the way, were it ever to come to the question of whether you wanted to die, would it be in hospital or would it be at home? And of course,
or put it quite a different way: is there anything that you would not want to happen?
Yeah.
So it's not dying at hospital or home. It's what is it that you would not want to happen? And in general, that leads the conversation. Well, I wouldn't want this to happen.
Yeah.
And then you can say. So it is. There are things that, and I think it's also making sure that you have the generalist district nurse support as well as the specialist support.
But technically, could it be done?
Yes.
But I mean, Macmillan, for example, would have to take on an enormous number of.
Well, I think there's a process in many areas. Areas have done it with a combination of Macmillan support, Marie Curie support, and just local district nurse support.
But district nurse has virtually disappeared in some places.
But I think then that's, if we have a country without community-based generalist nursing support, how can we possibly manage comorbidity in the future? Because people are going to have multiple illnesses, and if they're going to manage in the community, they're going to need that generalist support.
It actually goes to the heart of that awful debate about hospitals anyway.
Yes.
Where nobody likes to be told they don't actually need a hospital. What they need is actually community nursing, etc. Because treatment so much can be done at home, and even if you're not discussing dying.
Absolutely.
So it's a very, very interesting question, and I think useful answers. Does anybody want to pick up anything on that issue? Yes, let's take a man. We haven't had one.
Chris Curtis, just on that point there about letting people know, surely it's while you're well, that's when you should be thinking about it.
Exactly.
So should that not be started in the GP's practices?
And that's exactly what we're trying to do. So we've tested some training working with dying matters to look at introducing the conversation, and we found that if they go on the training, they start the conversation, and 70% of patients actually want to carry it on. 30% don't. But it's that I think that's absolutely right.
It's like John said, we're not thinking of dying at the moment, so
Yes.
maybe that words need to be changed.
Yes.
The PPC form.
Yes,
People
exactly.
like to
It is really tricky because cancer doesn't any longer mean dying.
No.
And lots of people might have cancer, but they'll die of something completely
But
different.
everybody worries about it.
Well, they do worry about it, but I'm even more worried if somebody turns to me and says, "Now, by the way, do you want to die in hospital?" I mean, you know what I mean? It's a tricky business. I'm not actually thinking of dying. You know, I mean,
That's what I said, the PPC form is a great form,
yeah.
but it all talks about dying at the end, whereas if they just change the words on it, more people would fill that form in, which would then start talking about what they want at the end.
There should be a phrase like, "if it ever came to it."
Isn't that a very, as everybody's saying, it's a very tricky question, whether you are suffering from the cancer or you are active, everything is okay, and somebody comes to you, do you want to die at home or in the hospital? When you are well, you are not have any indications, then you don't take it. But once I have 3 members in my family who died with cancer in the last 15 years, 3 members. So I know that when you are suffering from any cancer and how it hits you, not only to those who are suffering, but the people around them. When on one side you know it, that this person have few years, others, and he knows or she knows it. I have my personal reservations that whether it is in the next 5 years, but I think that dialogue has been opened. People have started talking about it. One day we will achieve it. Whether the 5 years is the...
I think we should go with Judith and stoke it, make sure it happens.
I think you really should, and I think it's something that you should challenge on.
Absolutely, and it's something we
and it's quite high
That's
profile.
why I said the
It's
debate
quite
started,
high,
people start talking about it.
But what's going to be happening is that because of the structure, and I don't necessarily agree with things like league tables and comparison tables, but if one area of the country is managing to achieve this perfectly successfully, then
Is there a model area? Let's name it.
It does beg the question, why doesn't mine?
I don't think I can pull that one out of my head.
Who can pull a good area out of that? I think you're going to.
I'd like to think that ours is a model Croydon.
Yes.
The area of Croydon where Croydon General Hospital is, formerly Mayday, we have the community matrons scheme.
Yes.
Yeah.
But they have expressed the pressure that they undertake because there's so many people needing the service at the moment, and they're worried about the quality, not the quantity, the quality of the care that they're delivering. And also your point, Virendra, about those associated, because they're impacted by a family member being ill. When we talk about adequate support, we need to be careful, because sometimes what happens is those people become ill also as a result of not having the support that they need. So it is a good model, but we need more nurses. We need more nurses in the community.
Excellent, excellent. I mean, so there's Croydon, and I love the idea of community matrons. I'd live in fear if I lived in Croydon. Are you a community matron?
No, I wish I was. I think they do a wonderful job, and on behalf of the Croydon area, as I say, this has been recently piloted and reintroduced, because there is a need, and we do have a big ward with a lot of cancer patients.
Maybe Macmillan should look at Croydon and write it up.
Please look at Croydon. Please lend us some more support.
There are issues also. It's not all about nursing, is it? It's also about social care as well. And I mean, I don't know the detail on it, but I do understand that there are changes afoot about how access to social care might be changing towards the final weeks of life, which, you know, if you're talking about supporting carers, then, you know, having help with, you know, with cleaning and washing and you know, all the other areas of support, social care that people need is really, really important. The other thing also I think we need to think about, which is connected to this, and that's to do with people who are diagnosed with very late stage cancer and diagnosed perhaps in an accident and emergency, and then is it possible for them to get home? And I think that the having the right incentives in the system to flag that up, and certainly the All-Party Group on Cancer, we've been pushing for there to be the collection of data and targets around, not targets is the wrong word, but outcome measures around the number of patients diagnosed at accident and emergency, because that is that's a really important thing that we've got to tackle. And then you can have, if you're diagnosed in less of a crisis, then all of these things can be managed, I think, much more effectively.
You had a point.
Yeah, I'd like to challenge the fact that it is actually a lot cheaper. Done properly, it's not cheap.
But a hospital bed is intolerably expensive.
I know, but actually in the community, and you do also have hospice beds. And I think, you know, the public is actually part funding a lot of that. There were other charities involved some time ago, and I think the Croydon one is tied up with St Christopher's and Bromley. And I actually ran a 24-hour community team 20 years ago. And we were then criticised for undermining GPs because we were available 24 hours. We could take all the equipment and everything else out. If you wait long enough,
it all comes round.
You know, I was Health Visitor. Health Visitor's got, you know, sidelined. Then I'm recruiting 4,000 of them to bring it back. And we're going to do the same thing with this. We've got the expertise, you've built it up. I as I said, did all this, and you've had all these research saying where people want to die. We all know where everybody would like to be. We've got to put the resources in there, and one of the biggest problems are the GPs. Because the GPs are not doing home visits, they're not there 24 hours. There isn't anybody that actually knows that person and knows the family. And if you don't do home visits, you don't know family. So there's a lot more to it, it's not just cost.
No.
No, I'm not suggesting it.
Yes, I think. I mean, I'd agree with all of that, and I think working with primary care is really important. I think that's one of the reasons why, from the Macmillan point of view, we've invested heavily in looking at how you change behaviour within primary care. And when we looked at end-of-life care, one of the most important things was the relationship between the district nurse and the GP, and that's actually what determined some of the major things, because sometimes there are so many people involved, none of whom know what's going on. But I'd also go back to the point about social care at the end of life, and the idea that if you are in the last few weeks of life, social care is free. And I think that's something which is very much being pushed at the moment, because I think that would help quite a lot of the processes.
Judith.
Just a really quick comment on GPs. GPs are terribly focused on their budgets. And of course, now GPs are being given the money to spend on the NHS. So I suspect that if there is any evidence at all that they can save money by actually having people die at home supported by community teams, they will go for it.
Could I just make a plea for GPs?
No, I don't wish to not.
Most GPs, and certainly the GPs that I've come across working with Macmillan, really want to do the right thing. You know, they don't want, they're not, you know, completely focused on money. They do want to do the right thing for their patients.
We've got one here. Why don't we hear from her? Oh, it's a question. Sorry. No, far away. Sorry.
I'm a big advocate for emotional support, and I think whatever stage of cancer you're at, you want to feel safe to talk about dying, and whatever stage, whatever age, wherever you are, you just want to know that you can say to someone, I'm a bit scared about that, and somebody not to say to you, of course you shouldn't be scared, you're not at that stage yet. So I think it's a lot about communication of the issue and the words.
Language is important.
Very important. Thank you very much. Well, that Rose took us on to a really very, very interesting area, and I think we're going to travel optimistically and hope that within 5 years, full and free choice, despite the costs, will be with us.